and you're watching CNBC-TV18.
Presented by ICICI Lombard Health Insurance. Journal partner, The Indian Practitioner. Exclusive media partner, Medgate. Magazine partner, Drug Today Medical Times. And Healthcare Executive. On-ground partner, Inox.
Focus. Ideate. Innovate. Enable.
According to WHO and the Indian Council for Medical Research, heart disease is the single largest cause of death in the country, with heart attacks being responsible for 1/3 of all deaths. And by 2020, India will be the heart attack capital. That's frightening. CNBC-TV18's AB Ravi spoke to eminent cardiologist Dr. Ramakant Panda to find out what is the cause for this alarming rise and how do we keep heart diseases at bay. This is what he has to say. Take a look.
Dr. Panda, welcome to the show.
It's my pleasure.
If I may begin by asking you, every minute 4 Indians die of heart attack and they are in the age group of 30 to 50 years. What is the reason for this alarming figure?
I think it's a large extent because of the lifestyle changes that Indians have gone through over the last 30-40 years, mainly related to very sedentary lifestyle now. People are not doing any exercise, any physical activity. Number two is the food habits have drastically changed. We are eating a lot of food which is very high in cholesterol, saturated fat. Third thing is, of course, stress, and then quite a bit use of tobacco as well as smoking. So all these things have, this total lifestyle change has created a situation where many people are becoming hypertensive, high blood pressure, diabetes, all these factors, what is called lifestyle related factors, which is causing this alarming increase in heart disease. If you look at it 30-40 years back, rarely could see somebody who is below 30 or 35 years of getting heart disease. Today almost every day we see patients who are below 30.
So is it an urban phenomenon, or does people in rural India also have heart attacks?
See, it was, till recently it was almost like urban phenomenon, but not anymore. If you see last 10 years trend, the rural areas are catching up quite a bit, and probably in next few years there will not be much of a difference between rural and urban India.
But by Indians, by definition, are they genetically prone to heart attack? But I was told that there were small coronary arteries. Is that also one of the reasons that they have heart attacks in India?
I think it's not really genetic, it's more related to lifestyle, related to our lack of exercise, and I think those are more related more to that rather than real genetic cause. Okay. So earlier used to think that genetic Indians are rather people from Indian subcontinent, they are more prone to getting heart disease. But I think it's a large extent it is related to lifestyle, the way we don't do that much exercise, we don't food habits, all these things has contributed.
But doctor, we have also heard people who are very health conscious or fitness conscious, jogging and gymming, also getting heart attack. What is the reason for this then? I
think there are two. One is the number of people who are doing gymming and number who are getting are very less. So occasionally somebody gets a heart attack, so that becomes a news. But for every person getting heart attack, well, 99.9% people don't get any. That's one. Second reason is also a lot of these people might have a risk factors which they themselves don't know. Suppose they might have a high blood pressure, diabetes, cholesterol might be high, which might have produced a cholesterol plaque inside. Third thing what happens is sudden heart attack is many of these patients, many of these people will have a cholesterol deposit only inside the artery without any blockage. Okay. When you are not, suddenly you start doing some exercise which is way beyond what you are normally do, unaccustomed exercise, sometimes that thing can rupture. So these are the three reasons why you see this.
Is one of the causes of death is because of demand-supply mismatch, doctor-patient ratio or patient-bed ratio. Healthcare is not accessible. So how do we change this? I was told there are one doctor for every 11 to 85 patients. Is that right?
Yes, you're right. It's 0.7 doctor, you are right, for 1,000 population. If you take into China, they have got 3 times as many doctors. So I think there's a huge supply-demand mismatch. I think the only way it can be done, one is increasing the number of more medical colleges, allowing more number of seats so that more people can come out with MBBS. And I think the second also equally important is If you see rural areas, still a large extent the major healthcare problem is sanitation, nutrition, hygiene, diarrhea, all those problems. So those things can be tackled by a group of doctors which don't have to go through 5 years training, which the health ministry had a proposal there working on it. If that works out, I think it's a very good idea to train these people in 3 years, send them to rural areas where the majority of problem is sanitation, hygiene and nutrition related, who these people easily can treat them. Yes, they can easily can treat those patients. You don't need to have a MBBS doctor who doesn't want to go to a village. So I think that on one end,
as far nurses be trained to do that? Nurses can be trained to...
Nurses also can be trained to do that. Many countries, if you see USA, nurses are trained to do the anesthesia work, critical care work, everything. The other end of the spectrum is specialists. There is a tremendous shortage of specialists in the country, whether the heart doctor, the kidney doctor, lungs doctor, everybody, there is a tremendous shortage. That's again artificially created because most of the countries, even USA, number of people who come out equivalent to MBBS, number of specialist positions for training is almost double. In India, it is 1/10. The number of doctors who come out, only 1/10 seat is available for post-graduation. It is a complete artificially created, which easily, if it is allowed to all the large good private hospitals, if they are allowed to give the same postgraduate degree, which happens in USA, entire Europe is like that. 80% of the postgraduate degree and training today takes place in private hospitals.
What is India, policy level change has to be policy changes has to be done.
It can do that. Allow all the large hospitals which to give postgraduate education. Overnight, these numbers can be changed because we are producing quite a significant number of MBBS doctor, but there is this big bottleneck in terms of giving postgraduate degree. Huge imbalance there.
Doctor, what are the main kind of heart disease that people suffer generally? Is it blocks or the other cardiovascular disease? Generally, what are the people suffer?
Yeah, there are 4 types of mainly category of heart disease. One is ischemic heart disease that everybody knows about, the blockages, heart attacks. The second commonest is the children's heart disease. Third one is patients who have got a valve problem. Fourth thing is a muscle weakness called cardiomyopathy. But the first category that I talked about, ischemic heart disease, that affects all majority of patients. Almost 80% of the patients in India are in that group.
So what is the symptom for that?
Symptoms is mainly people, this occurs in, when the person is stressed out. Either during physical or mental stage, you start getting chest pain, and the moment you take rest, it goes away. Again, chest pain unfortunately is only present in 50-60% patient population. 30-40% do not have symptoms, or they have other types of symptoms like breathlessness. While exerting yourself, you get breathless. Sometimes this pain also you can get in the jaw. People have gone to dentist and got treated, but they had heart problem. You can get a hand or shoulder pain, and you can get a stomach pain, because all these areas, the nerve supply comes from the same source. So heart pain is called referred pain. It can happen any of these places. So yes, so basically we look at people who have got a high risk, like diabetes, high blood pressure, smokers, or strong family history. And if they have this kind of symptoms, immediately they should try to get themselves investigated.
Doctor, according to WHO and Indian Council for Medical Research, by 2020, India will become the heart attack capital of the world. Or India will become the heart attack capital. Now, this is a worrisome statistics. How do we tackle this?
It's almost we have become heart disease capital of the world. If you look at it, Indians or people from this subcontinent are almost 3 times more likely to get heart disease than any population anywhere in the world. The other thing, there was a statistics from WHO again, who have predicted that between 2005 and 2016, almost $240 billion loss will be because of loss of productivity from lifestyle related diseases. And major part of the lifestyle related problem is diabetes and blood pressure, heart disease. So it's getting very, very common.
So what is the role the government has to play according to you?
I think government has a very, very significant role in all aspects. One is affordability, providing universal healthcare insurance, which many countries in the world have done that. I think that especially at least to below poverty line and people who the lower mid-income group, to providing universal healthcare insurance. Number 2, of course, increasing the number of specialist training positions all over the country.
Supply side.
Yes, supply side. And third thing, I think they can also help in quite a bit. They can is in health education, making people aware about it and enforcing certain regulations like avoiding, putting a ban on tobacco or both in terms of smoking as well as in terms of tobacco use. They're completely putting a ban in the country. Those things they can do.
Okay, finally, doctor, what is the advice you would give people to avoid a heart attack in terms of their lifestyle or in terms of the habits, in terms of everything?
My advice will be to entire population, to entire country, is to go on a preventive way. Try to prevent the heart disease rather than wait till the heart disease happens and then you try to get treated. It's going to be very, very expensive. And hardly 10% population can afford. So it's very, very important to go preventive. That's where you have to be very strict about your diet, your exercise, yoga, and I think everybody above the age of 30 should at least get once in a year checked out to make sure that, to identify in case they have got diabetes or high blood pressure, because these are called silent killers, because most of the time these patients don't get symptoms, especially those who have diabetes and high blood pressure. It's only after many years when it is already damaged many part of the body you come to know about it. So I think very important to do a preventive checkup once in a while to make sure that you don't have diabetes or blood pressure risk factors. Lead a healthy lifestyle and do adequate exercise. If you ask me, one thing that can the most effective in reducing heart disease is exercise, leading a very active and physical active lifestyle and doing exercise daily.
Dr. Parna, thanks a lot for talking to us. It's a pleasure talking to you. These days, one is hearing too many cases of cancer among friends and office colleagues. What is the reason that the incidence of cancer is too high now? What is the reason behind this?
अब 1 अक्टूबर तक नो शॉपिंग आ गया है फ्यूचर ग्रुप का 12 months free shopping festival.
In an economy driven by experience, watch a power-packed discussion on the need to align business to the customer's decision-making journey.
Humans basically go only by one thing, that is experience.
In an experience industry, it's about personalization.
The experience economy is really about creating this shift where basically the decision makers are the consumer.
At these times, only on CNBC-TV18.
CNBC-TV18 now brings you the greatest investment opportunity. 3 books that'll change your relationship with money. 16 personal finance principles every investor should know. A book that introduces the basics of money and investments. How to be your own financial planner in 10 steps. Your guide to wealth without the complex formulas. And 11 principles to achieve financial freedom. A book that'll empower your wealth creation. Master your financial life. SMS CD Master to 51818 or mail us at cd@network18online.com.
CNBC TV18 and HUL's Lessons in Marketing Excellence gave us a chance to pick on the brains of India's biggest advertising gurus. It was an extremely inspiring and a great learning experience. We felt absolutely elated and very proud on seeing our film on all major channel networks.
CNBC TV18 and HUL present Lessons in Marketing Excellence, Season 6.
Presented by Hindustan Unilever Limited. Associate sponsor Frederic Constance Geneve.
My mom, she makes underwater fans that are powered by the moon. She makes aeroplane engines that can talk. She makes trains that are friends with trees. My mom works at GE.
Project Management Institute is back this year with its national conference in Hyderabad that focused on how project management is the mantra for sustainable growth.
This conference provides a platform for the practitioners to understand what's happening in this field.
I think that something important is ensuring that the organizations know how to measure the outcomes, the metrics.
Catch Project Management National Conference India 2014 only on CNBC TV18.
Presented by Project Management Institute.
Madhya Pradesh, heart of India, now the center of gravity for investment.
ग्लोबल इन्वेस्टर समिट में आइए, आपका हार्दिक स्वागत है।
Cancer has become one of the 10 leading causes of death in India. Every year, over 4 lakh people die because of it. Experts say the incidence of the killer disease is expected to rise by 5-fold. CNBC TV18's AB Ravi spoke to eminent oncologist Dr. Anil De Cruz to find out how we can check this menace. This is what he has to say. Take a look.
Dr. De Cruz, welcome to the show.
Welcome, thank you.
Dr. De Cruz, I may begin by asking you, these days one is hearing too many cases of cancer among friends and office colleagues. What is the reason that the incidence of cancer is too high now? What are the reasons behind this?
The incidence of cancer is increasing. Cancer is basically a lifestyle disease. There are two major changes happening in our country. The longevity or the length for which people live has increased and our lifestyles has improved. As a result, we see an increasing incidence of cancer. Moreover, there are a lot of treatment facilities, lot of institutions that now treat cancer. So people are getting more cancer. They are aware that there is a treatment available, and that's why you see more and more cases of cancer in the country now.
What would you say is the most prevalent part of cancer? If you were to...
You mean the type of cancer? 2/3 of cancers are lifestyle related. And in lifestyle, your habits are the most important. Tobacco is the #1 culprit. So in our country, 40 to 50% of cancers are tobacco related. There are other factors as well. Another very major part of causing cancer is infections. HPV, that's human papilloma virus, it's responsible for cervical cancer in women. Okay. You can also have HPV cancers now affecting males in the oropharynx, which is the back of the throat. Okay. Hepatitis B infection, H. pylori infection. So about 10 to 15% of cancers are infection related. Another 10 to 15% of cancers may be because of obesity. So when you get fatter, there are certain cancers that you are more prone to. Two classical examples in women are breast cancer and uterine cervix, that's the body of the uterus. Okay. So those are obesity related cancers. So like I said, 2/3 are lifestyle related, and you have lifestyles that predispose to cancer.
When you say lifestyle related, are you talking about the food we eat? Can it also be genetic that people can get cancer?
So about 1/3 of cancers then, which are left, would be non-habit related, and those would have a genetic predisposition.
Yeah, that's what I was coming to. I know friends of mine who are no vices, who are vegetarian, but they have had cancer. So how do you explain that?
So there are two ways to answer this question. So let me take a tobacco related cancer. A tobacco related cancer, like let's say cancer of the head and neck, 1/3 of our country has head and neck cancers of all cancers, and it's tobacco related. So of all tobacco related, if I went into the ward and did a round, 90% of patients there would be tobacco users. So even tobacco related cancers would be seen about 10% of non-tobacco users. And maybe those people have a genetic predisposition to this. Apart from that, there are certain other cancers that are predominantly genetic. To give you an example, retinoblastoma, which is an eye tumor in children, it runs in families. So you can have 5 siblings all with a retinoblastoma. You have medullary thyroid cancer that runs strongly in families. You have colonic cancer that runs in families. Breast cancer may run in families. So you do have certain cancers which are genetically predisposed. There are certain cancers which are totally habit forming, and there are some that are a cross between a genetic predisposition that you get because you have a substance abuse or the environment causes this kind of cancer.
So in terms of strike rate, suppose there are 100 cases of cancer in your hospital or in the country, how much is curable? Would be the strike rate would be 70%, and what is the chance of relapse then?
To make it very simple, cancer is in 4 stages. 1 and 2 are called early stages, 3 and 4 are advanced stages. Of 3 and 4, 4 is usually a cancer that is spread to other parts of the body. And these cancers we call incurable. Less than 5% will survive 5 years. So in terms of survival, when we talk about cancer, it's 5-year survival. If you live past 5 years with your index cancer, you're probably cured of that cancer. So now let's take stage 1. 90% of patients will go past 5 years. Look at stage 4, 5 to 10% will go past 5 years. So the crux here is you need to diagnose cancer early. Unfortunately, in our country, 60 to 70% of our patients come with locally advanced cancer, stage 3 and 4. So then when you look,
living in self-denial that they can't get cancer, or is it lack of
multifactorial. So it's because they live in self-denial, they don't have access to good health care, they probably are not aware of the warning signs of cancer.
Is it also a demand-supply mismatch? You know, number of doctors to patients, number of hospital beds to patients is abysmally low. So treatment is not available. So that is the reason, one of the reasons for death.
Really, the reason why we have poor rates, to some extent, yes, we don't have institutions that can treat patients adequately. More importantly, patients seek coming to institutions in very advanced stage. And that's primarily because of lack of awareness. Lack of awareness. So you need, so there are 2 ways that you can, overcome and get patients in early stage. One is to screen for cancers. Screen means governments run screening programs where they go out and target certain sections of society. Like say you want to screen for breast cancer. You run a program at a healthcare center where every woman in the childbearing age, say between 25 and 60 who are at risk of breast cancer, are examined by a social worker and you diagnose cancer early.
Are everybody willing, suppose tomorrow the government creates a national awareness program on cancer, that everybody should voluntarily can do it? Would you think there will be takers for that?
No, so at this point in time that may not be the right approach to do.
But I may not be cancer susceptible, but still I should be doing it.
Yeah, no, but given our health priorities in the country, given the research done on screening programs in the West, some in this country, really doing screening of general population is not cost effective. We have other healthcare priorities.
Sure.
So what's the next best? The next best is to make people aware. There is a disease called cancer. 70% of our cancers in this country are uterine cervix, breast, head and neck, lung. You tell people the warning signs of these cancers. You have these symptoms, go see a specialist, go to your healthcare provider, run simple tests and we'll diagnose you in stage 1 or 2, where we have a cure rate of 80 to 90%.
Okay, for a final question. Today I think something like 4 lakh people die of cancer, and WHO is predicting by 2015 7 lakh people.
Correct.
And we're also going to become the cancer capital. That's what WHO is saying. So how do we change the scenario, which is very depressing now, to a very positive one and give people hopes? What are the things you think the government should do, the institution like you should do, and what are the advice you would give the people?
So I'll give the people the advice first. Okay. Remember that cancer is curable if detected early, and cancer, or let me say the majority of cancers are preventable. As is your lifestyle, so is your cancer. So whatever habits you have in moderation. Absolutely no to tobacco. There is no advantage smoking. You run the risk of 50% of cancers of this country if you take tobacco. You drink, it should be absolutely in moderation. Keep your weight under check. No infections, good hygiene. To the healthcare we have, or to the people who drive or the policy makers, we have our priorities. Infection is a problem. We have diabetes, we have tuberculosis, we have so many other problems. Cancer is also one of these. But again, a lot of these non-communicable diseases are interlinked. Diabetes, hypertension, cardiac, cancer, all lifestyle related, smoking, drinking, you can have all. So if you start controlling the lifestyle, you'll decrease the incidence of all these. And I also think the way I feel that we can improve is, one is improve our regional cancer centers. We have one regional cancer center in every state in this country. So we need to upgrade them. If I can count, I'll be able to count on my fingertips the ones that really offer comprehensive cancer care to our patients.
This is where the demand supply and we see the
correct. And the other way of overcoming this is, we've got so many medical colleges, over 300 medical colleges, more than half of them are government run. If you have an oncology division in each of these medical colleges, again treatment will go to the masses in a big way.
That's a good solution.
Yeah, so I would suggest.
Okay, Dr. Cruz, thanks a lot for talking to us. Pleasure talking to you.
Pleasure, likewise.
Focus. Ideate. Innovate. Enable.
Presented by ICICI Lombard Health Insurance. Journal partner, The Indian Practitioner. Exclusive media partner, Medgate. Magazine partner, Drug Today Medical Times. And Healthcare Executive. On-ground partner, Inox.